First of all, I want to remind you that temporal bone, it is the pair bone. And our temporal bone, it is forms our neurocranial. Let's say it forms the cranial box. But in the same time, my friends, temporal bone forms two parts of the cranial bone. Cranial box. Look here, please. One part of it, which we call the squamous part, and second part of it, which we call tympanic part, they forms the fornix, or we call it calvaria. Another two parts, it is the petrosus part and mastoid part. They forms the base. Let's say once again, guys, listen and remember. Our temporal bone, it is bone of neurocranial. It contains four parts. Look, everybody here. The biggest part, which is located superficially, we call squama os temporalis. You can easily palpate it here. Squama, this is the squama os temporalis. Second part, my friends, look here, please. It's better visible here. Look. We call tympanic part. This is the part which is surrounded external meatus of the ear, porus acousticus externus, pars tympanic. Both these parts together forms the calvaria, or the fornix of the skull. Another two parts, it is mastoid process. Put, please, everybody, your finger behind of ear and palpate, please, here the triangular structure, which we call mastoid process. And last part, of course, it's unpalpatable because it's located inside of the cranial cavity. Look, please, here. This is the last part, which is connected with sphenoid cord. We call it the petrosus part of the temporal bone. Petrosus and mastoid part forms the base of skull. Now, point by point, I will explain you all the portions which we have, and let's start from pars petrosa, from petrosal part. Now, my friends, I will think will be better if you will put and come to here, stand up, because the structures which I show will be invisible for you. This is the petros part. Look here, please. Our petros part pass from back to anteriorly, from inferiorly to superiorly, and from laterally to medially. Let's say from posteriorly to anteriorly, from inferiorly to superiorly, and from laterally to the medial. Middle shape form. We describe three surfaces and three margins for petros part. The surface which I show and which I palpated, we call superior surface of the petros bone. Second surface we call posterior surface of petros bone. And last surface we call inferior surface of petros bone. It's a superior surface, posterior surface, and the inferior surface of the petros bone. Petros bone is we call also anterior. It's a anterior, posterior, and inferior. It has three margins. The margin which is divided anterior surface from posterior we call superior margin because it has the most superior position. The margin which is divided posterior and inferior surface we call posterior margin. And finally, the shortest margin which is located in the anterior surface we call it anterior margin. This is superior, inferior, and anterior margins. Let's start from anterior surface. On the anterior surface we have several depressions and we have several grooves. First of all, look here, please. On the posterior, put your finger here and palpate it. In the posterior part we have very good palpatable depression. We call it depression of trigeminal nerve. So here the trigeminal nerve is located. We call it fossa nervi trigemini. In anterior part, my friends, just here, we have second depression, which is also good visible. Maybe I will show it better in the picture because this bone is very small. Yeah. 1 minute, go to our picture, guys. Go to pictures. One picture is close to another. Let's say in your home. Don't forget to move it to see what is located behind. Let's say, my friends, this is trigeminal one, like I said you before, and posteriorly we have second one, which we call tegmentum tympani. Let's say, look here, please. Trigeminal depression, yeah, and tegmentum tympani depression. Between them we have eminentia tympani, vice versa, not depression but the promination part. And look here please, we have two grooves. Groove for nervus petrosus major and groove for nervus petrosus minor. The groove and aperture continue. Let's say there are aperture, fossa, foramen nervi petrosus major and foramen nervi petrosus minor, and the groove which is continuous from this aperture, sulcus nervis petrosus major, sulcus nervis petrosus minor. Now, my friends, if you will look to the margin of superior margin, you will see very good developed groove, which we call sulcus sinus petrosus superior. That's a sinus petrosus superior located just by superior margin. Now let's look to the posterior surface. First of all, on the posterior surface, you will see good developed aperture, which we call porus acousticus internus. This is porus acousticus externus. That is porus acousticus internus. Near of this aperture and little laterally and big to it, we have canalis cochlearis, the cochlear canal. Nervus cochlearis pass through this canal. Remember, please. And by inferior margin, we have one more groove, which we call sulcus sinus petrosus inferior. If you remember, samely sulcus sinus petrosus inferior, we have in the lateral part. Let's say from here, it is continuous to the occipital bone. If you will look to the whole, if you will look to the whole cranium, you will see that it is here. Let's say from the petrous part of the temporal bone, it is come to the occipital bone and passed together between these two structures. Let's continue. In inferior surface, guys, again, there are several important structures. First of all, it is processus styloideus. Behind of processus styloideus, we have foramen stylomastoideus, which is continuous to the canalis stylomastoideus. From this aperture, nervus facialis come to outside. 7 cranial nerve. Let's say it is come to outside by foramen stylomastoideum. Before coming to outside, it's located inside of the petrous part of the temporal bone, inside of canalis nervi facialis. Let's say in the petrous part, there are special canal, which we call canalis nervi facialis, and inside of this canalis nervi facialis, we have nervus facialis. And by foramen stylomastoideum, it is come to outside. Let's continue, my friends. Little in front of porus acousticus internus, we have incesura jugularis. Incesura jugularis together with the incesura jugularis of the occipital bone forms the foramen jugularis. You remember incesura and processus jugularis we have in the occipital bone. By the same incesura of the temporal bone, they forms the aperture, which we call foramen jugulare. By the way, by this aperture, the biggest vein of cranial cavity come to outside. This is vena jugularis interna. Let's say internal jugular vein leave the cranial cavity by this aperture, which we call foramen jugulare or jugular aperture. Let's continue. In the inferior surface, except the structures which I show for you, there are two canals. The canals located just on the margin, look, and by the septa, they divide it to each other. These canals will be better, maybe I will show better visible in this picture. Open it, please. Next slide. This one. Yeah, it is 19.1, guys. Not so good visible, but here maybe it's a little better visible. It is the musculotubular canal. Musculotubular canal divided into two parts. Upper we have the muscular one, lower we have the tubular one. Let's say together we call it musculotubular canal. This is about petrous part. Now let's come to the squamous part. This is the squamous part. It is the biggest part. Put your fingers and palpate it. Please. You can see that it is very thin. Compare it, for example, with the parietal bone or with the, for example, frontal bone. You can see that it's very thin. Why it is thin, guys? Because it contains not 3 layers like usual skull bone, but only 2 layers. Diploitic layer is absent here. That's why we have only external compact layer and internal. That's why remember, please, it is most usual place of skull bone fractures. Let's say it is the thinnest bone of our skull, and it can be easily broken here. Unfortunately, if it will be broken on the inner side of this bone, you can see very good developed grooves. Very good developed grooves. Do you see these grooves?
Yes,
It is place of location of vessels. Here we have arteria meningia media, middle meningeal artery, which is supplied the dura mater. It comes to the cranial cavity by foramen spinosum. You remember, which is located in greater wing of the sphenoid bone. By foramen spinosum, it is come to cranial cavity. And why I tell you now about it? If will be the fracture of the squama, this middle meningeal artery can be damaged, and it will form big hematoma inside of the cranial cavity. That I remember, please. Let's continue. Which structures we have in the squamal part? First of all, my friends, you see very good developed process, which we call zygomatic process of the temporal bone. Zygomatic process of temporal bone connected with temporal process of the zygomatic bone. And they form together the zygomatic arch.
Okay.
Inferiorly zygomatic process, you can see good developed depression, which we call fossa mandibularis. In the place of fossa mandibularis, my friends, the joint is formed by the mandible. It's broken, unfortunately. You can see it here. And in front of it, we have the spina mandibularis, which is stop the movement of the mandible to the anteriorly and fix it inside of the fossa mandibularis. Let's say this is the process which we call condylar process of the mandible or articulation process of mandible, and it forms the joint with fossa mandibularis of the temporal bone. Remember it, please. Let's continue. Behind of the squama, we have the next part of the temporal bone, which we call the mastoid process. Mastoid process has the triangular form, guys. And what is interesting? First of all, behind of it, you can see good develop incesura mastoidea. And behind of incesura mastoidea, you see one more groove, which we call sulcus arteria occipitalis. Here we have occipital artery, which is supply not only mastoid region, but the occipital region of frontoparietal occipital part of the head. Near the base, it's not so good developed, but you can see mastoid aperture, foramen mastoidea. It is place of location of emissary vein. Just in the previous lesson, I show for you what is emissary vein. Look here, please. This is the vein which is connected three venous layers to each other. Superficial, middle, which is in diploidic layer of bone, and intracranial veins. Emissary veins doesn't have the valves. That's why blood can circulate it and from superficially to deep and from deep to superficial. That's why one of emissary veins located inside of this foramen mastoidea, which is connected superficial veins with sinus sigmoideus. Sinus sigmoideus located on the inner surface of the mastoid process. You can see inside of this groove located one of the biggest sinuses of our cranial cavity. It is sinus sigmoideus. Sinus sigmoideus, it is continuation of transverse sinus. Finally, sinus sigmoideus come to the place of jugular aperture, and through the jugular aperture it continue to downwards like the internal jugular vein. Remember, please, in the place of foramen jugulare, the bulb of internal jugular vein will be formed by sigmoid sinus. Let's continue, my friends, and finally we come to the tympanic part, which is surrounded foramen meatus acousticus externus, which is presented here by porus acousticus externus. Remember, please, we have porus acousticus externus and we have porus acousticus internus. This is internal aperture acoustic. This is external, that's an internal aperture located, remember please, on the posterior surface. External aperture located just superficially between zygomatic process and mastoid process here. Surround to this tympanic part, you can see good developed groove. Part of this groove divided tympanic part from mastoid process. Part of this groove divided it from the squama. That's why we call it tympanomastoid groove, tympanosquamous groove, and divided it from the neighboring portions. This is mainly, my friends, what I want to tell you from the temporal region. there are several canals. First of all, it is the canal of the facial nerve. I say it before for you. Second canal, it is the carotid canal. Carotid canal has two apertures. External aperture, which is located on the inferior surface, and the internal aperture, which is located on the tip of the petrous part. Through these two apertures and through the canal, internal carotid artery passes. Internal carotid artery after come to the sulcus caroticus, which is located near the body of the sphenoid bone. And you remember, internal carotid artery, this is the main artery which is supplying all structures in the cranial cavity, mainly the brain. There are 2-3 small canals also, canalis chorda tympani, canalis musculotubularis. All the information is given, you will read. And next lesson we will discuss all the questions. That's it. I give you only one